important and basic topic for all the students as well as postgraduate as well as doctors and for the society as well. Contraception, what is it? It's actually a deliberate attempt to avoid the pregnancy. We should be happy that India was the first country in the world to formulate a national family planning program in 1952. Why it is important? So, contraception is important to limit the population, as this is very important aspect in our country, as our population is, we all know that it needs control. Sexually, it also prevents sexually transmitted disease like AIDS, HPV, genital herpes, chlamydia, etc., etc. Medical problems like severe heart disease, liver disease, kidney disease, in such cases, we all need to avoid pregnancy because pregnancy is an extra stress to a woman, so her condition might deteriorate. Another important aspect, cause for, I should say another important indication is birth spacing. We always want to give space between the two child. If it is not proper spacing is being given, then of course the mother as well as the newborn will suffer. Any previous obstetrical complications, we have to keep in mind. If it is a severe complication, better to avoid pregnancy. And early marriage in our country, still the marriage is in our villages and all, girls in an adolescent age, they got married and got pregnant. So early marriages will here also the role of contraception is very crucial, because it will prevent pregnancy, and the girl will the time she'll get to develop properly, and then subsequently she might get pregnant. This is the female genital organ. We all can see the uterus. This is tube, this is ovary, and this is vagina. So contraception, whatever contraception we are going to discuss, it has to act either of the places, either ovary or tube or uterine cavity, or it might prevent the ovulation. What are the methods? Oral contraceptive, it could be oral, it could be injectable, it could be intrauterine, or it could be transdermal or transvaginal. So another method, barrier method, which we call condom, for example, it is also a good method of contraception. Natural family planning methods, coitus interruptus, lactational amenorrhea, permanent sterilization. These are all method of, apart from permanent, all are temporary method of contraception. So here you can see, right from oral contraceptive pills, there's an implant, emergency pill, vaginal ring, spermicides, cervical cap, injectable birth control, intrauterine contraceptive device, and contraceptive patches. There are a lot of methods available for a eligible female couple, and they have to choose what they want. But of course, as a doctor, clinician, we have to explain them which method would be suitable for her and which is going to be more effective. So now this is important. Contraception means you want to prevent the pregnancy. So less the failure rate, better is the effect of contraception. So combined oral contraceptive pills is the most effective contraceptive method. You can see 0.1% is the failure rate. Progestin only pill is 0.5%. It is also good. Intrauterine contraception, one is Mirena, another is Copper T. It is also very good because you can see Mirena is 0.1 and Copper T is 0.5%. Injectable progestins have little higher, 0.3%, vaginal in 0.7%. Spermicidal, again, it is going up 6%, and withdrawal has got 4%. It's quite less effective. These are another methods, period, calendar method. You can see ovulation methods, symptothermal methods. These are not very good methods because the failure rates are quite high. Sterilization is 0.05%. This is again for female, and for male it is 0.1%. So mind you, sterilization is not 100% proof for contraception. Combined oral contraceptive pills, we all know, and is most widely used. It's very effective. As you see, 0.1% is the failure rate. It could be monophasic, biphasic, and triphasic according to the composition. Drug interruption, but it has got drug interruption as well. Any patient who is on ATT, then the effect of oral contraceptive pill will be affected. It will not be as effective as a lady who is taking only this contraceptive pills, not the rifampicin or phenytoin. So these two drugs used to interfere with the oral contraceptive pills. What adverse effect is? It is diabetogenic, means it might cause blood sugar derangement, increased coagulation factors, cholestasis, deventhomosis, post-pill amenorrhea, and chlasma. Chlasma is a hyperpigmented patch over the face. So that's why this combined oral contraceptive pills are contraindicated. Patient who has, whenever you prescribe, we have to ask for the history of thromboembolic disease, cardiovascular disease, diabetes with vascular involvement, uncontrolled hypertension, breast cancer, cancer of any female genital tract, liver disease. In these patients, we should not advise combined oral contraceptive pills. So, what are the beneficial effects? So, these combined oral contraceptive pills, it increases bone density, reduced menstrual flow and anemia. So many times we used to give in patient who has a abnormal uterine bleeding and anemia, we used to give this, and since the blood loss is less, the anemia gets corrected. Decreased risk of ectopic pregnancy, because ovulation is being we are preventing ovulation by giving combined oral contraceptive pills. Fewer premenstrual complaint, because ovulation, natural ovulation is not we are preventing natural ovulation, so the premenstrual symptoms are again less, and it also improves dysmenorrhea. It also decreases the risk of endometrial ovarian cancer, as ovulation is not being taken before. The ovarian cancer risk are less. Endometrial cancer is again, it has been documented that it prevents reduction in the various benign breast diseases. It improves acne, improves in the rheumatoid arthritis. So these are the beneficial effect of combined oral contraceptive pills. Transvaginal administration. So what are the things we can use for transvaginal? So Nova ring is a flexible polymer ring, which is 5 into 5.4 centimeter diameter. You can put in the vagina, and it contains both estrogen and progesterone. It gets released from the ring and absorbed from the vaginal vascularity. Systemic hormone level is lower than the oral, so the side effect is less in this case. Placed within 5 days of when it has to put within 5 days of onset of periods, and removed after 3 days of use. So approximately 4th week it has to be out. Once dispensed, its shelf life is 4 months only. There's transdermal patches also. Evera, it comes with the name of Evera. It contains it is about 20 centimeter in dimension, 2 square band-aid kind of thing. So it delivers 20 microgram of ethinyl estradiol, 150 microgram of norelgestromal, applied on the buttock, outer arm or abdomen, and it is applied for 3 weeks, followed by a patch-free week when the female will have periods. Well tolerated, safe. Sometimes because it is a patch, it might cause skin reaction. So alternative to oral contraceptive is a good option. Instead of daily, weekly, just to put a patch and forget for 3 weeks. Failure rate is slightly, it's higher, 1.2% as compared to COCP. Progestational contraceptive, we also call it mini pill. It comes in injection, implant, or the progesterone is also now been incorporated into the intrauterine contraceptive device. Mini pill should be taken at the same time because it's hormone, the half-life and the blood level it should be which we have to maintain a blood level, so it has to be given at the fixed time. Disadvantages are it causes irregular bleeding PV, it causes amenorrhea, headache, breast pain, and because it causes little water retention. This POP, the progesterone only pill, is ideal for hypertensive patient because the progesterone has little effect on blood pressure, sugar, etc. So it can be given in hypertensive patient, lactational mother, migraine, those who have migraine, smokers, and patient who has more than 35 years of age. Injectable progestin contraceptive comes with the two types. It's Depo-Provera or Norgestin, and the doses are it's 150 milligram every 3 months. Monthly it has to be injected. The adverse effect or side effect is it causes bone loss, but it is reversible after discontinuation of the injection. There are implants also. We call it Norplant. It is called the hormone comes in the 6 Cialistic rods, and it is being put in the under skin in the arm usually, and it is effective for 5 years and removed after 5 years. It is unpopular because it has to be implant and it has to be removed. So this is the Norplant. When we were students, we used to put it, but now it is almost it's very little. It's being used now. Once a month pill is, the trade name is Lonele, and it contains 5 milligram of estradiol, cypronate, and 25 milligram of medroxyprogesterone acetate. Once a month injection every 28 days interval it has to be given. And return of fertility is more rapid than only progesterone injectable contraceptive pills. But there's the side effect is weight gain, and it is also not available in India. Now, up till now, we were discussing about the hormonal contraceptive pill, steroidal. Now, we come to mechanical methods. Mechanical methods, the most popular is intrauterine contraceptive device. This is popular because once it is put in the uterus, you have to forget, nothing else you have to do. It is effective, it is reversible. If you take it out, patient will get pregnant. And with monofilament sting, risk of pelvic infection is also less, which earlier it used to be a bit high. So what are the type of intrauterine device? So if you start the history, initially the Lippes loop used to become then copper T 280. Now 380A is government of is the commonest IUCD being used, and it is a government supply. And it is for 10 years. 10 years it gives protection to a female from pregnancy. So this is the picture. This is this is a copper T 380. This is a multi-load, and this is a Marina, which is here the progesterone is impregnated in this device. So apart from contraception, it also gives a benefit of heavy bleeding, abnormal uterine bleeding. So as I already I've told, Marina is hormone. It contains hormone, so it releases progesterone, and it is effective for 5 years. So it has, apart from contraception, it helps in medical. If the lady has a bleeding issue, it help take care of that also. And its effectiveness for contraception is also better than copper T 380A. So the same thing what just I told you. So the therapeutic effect is with abnormal uterine bleeding and as a contraception both. Here the good thing is, if there is a contraindication for oral contraceptive pills, you can use IUD. everything comes with a certain amount of side effect or adverse effect. So here also this intrauterine contraceptive device might cause uterine cramp because we have put something, it is a foreign body, so uterus tries to expel it out, and then the female will feel crampy pain in lower abdomen, but gradually with this mild analgesia it goes off, but sometimes it is not tolerable, then it has to be out. Menorrhagia, sometimes it causes heavy bleeding, copperty, especially not the marina. Infection, because something we have put, so if it is not being put with proper sterilization, it might cause infection because the copperty thread is always out. So proper hygiene has to be maintained, and if it is not properly put, it might cause perforation. So, and it is less protective for ectopic pregnancy because here the ovulation is not being prevented. Here only the implantation is prevented. So if I am putting anything in the uterus, the pregnancy, I'm preventing pregnancy in the uterus, but not preventing pregnancy in the tube. So chances of ectopic pregnancy is quite high in such patients who are having copperty. So contraindication, before putting copperty, one has to, or intrauterine contraceptive device, one has to be very clear about the emptiness of the uterus. So always we have to ask for last period. If there is overdue, urine test must be done to rule out pregnancy. Then uterine anomaly. If there is any anomaly in the uterus, congenital anomaly, there will be difficulty in putting and many times you won't be able to put the intrauterine device. Pelvic inflammatory disease. So if you assess, you feel that uterus is tender, fornices are tender, then first give you her antibiotic, let her be symptom free, and then you can put the IUCD. Any suspicious of genital malignancy, you should not put IUCD because it might aggravate the problem. Genital bleeding of unknown etiology. We don't know where from bleeding is, what is the cause of bleeding. So first rule out the causes of bleeding. If it is settled down, then you can put, otherwise you treat the cause of bleeding. And if suppose a person is allergic to copper, then also copper T should not be put. Then comes the Barian method, is also also effective and popular method. Male condom, female condom also comes. Spermicide is a chemical which kills the sperms. Diaphragm plus spermicide being also used. Sponges, cervical cap. But these methods are not very popular because of infection, because of less effectiveness. So Barian method is male condom, female condom also comes, and the good thing is that the male condom is good in the sense it prevents STD, not 100%, but in a good ratio. It prevents in this sexually transmitted disease, and it is effective. But female condom is not that. Spermicide is a chemical which comes in jelly, cream, suppository, film, foam. So it has to be put inside the vagina. So there is some thing which are putting inside the vagina from outside. So risk of infection is very high here. Make a physical barrier for sperm plus act as a spermicide, like cervical cap, and then put the spermicides. These are basically the active agent here is nanoxynol 9. Spermicide must be deposited high in the vagina in contact with the cervix shortly before the intercourse, and duration of action is just 1 hour. So it's a little risky in preventing pregnancy. Diaphragm plus spermicide, as I told you, the risk of toxic shock syndrome is high here. So because of these regions and because of slightly increased rate of UTI, these methods are not very popular. Contraceptive sponge comes the name of today, and the active component, as I earlier told, is nanoxynol 9, impregnating in a disc, and it has to be put 24 hours before the intercourse, and it is more convenient than Barian method, but it is not very much effective, means failure rate are quite high. Cervical cap is natural rubber fitted around the cervix. Proper application is important, and if it is being used with spermicide, it is effective, but as we all see that it has to be applied on the cervix, it is not easy for all women to use this. Natural family planning methods are calendar method. Patient has a fixed cycle, then she can mark on the calendar that this is the period time, and the middle part, the days, 7 days or 10 days around ovulation is unsafe period. Basal body temperature is actually, it rises when there's ovulation. Cervical mucous method, after ovulation the mucus becomes more clear, and this is also a way, and combination is symptothermal methods. So calendar method is, if you are very sure of periods, then ovulation usually occurs around 14 days from the next period. So that part is fixed, that part of menstrual cycle is fixed. So unsafe method is actually, if you want to calculate, you calculate 18, subtract 18 days from the shortest cycle and 11 days from longest cycle, and the period of the days which comes, that will be unsafe time for you. For the basically that time is good for pregnancy. Women with irregular cycle cannot use, because then ovulation, obviously the calculation will be wrong, and it is not effective as the pre-ovulation days are not fixed because the periods are not fixed. Temperature rhythm method is also a way of contraception. Temperature, you must know temperature at rest and just after getting up from sleep without taking anything from mouth, and avoid sex from first day of menses till 3 full days after rise of temperature, because with ovulation temperature used to rise, and then 3 days you should avoid the intercourse. Based on the slightly rise of temperature, usually the temperature doesn't rise much with the ovulation, it rises with 1 degree. It's not popular because it is not effective, it is very subjective thing, so it is not popular at all. Cervical mucous method, we also call this belly method. These are all old methods, and because just to complete the list, I'm putting all this but these are not very popular method, not very effective. Based on vaginal dryness and wetness, every female has a time when there is a dryness and there is a wetness. Abstinence begins of the menses, means avoid intercourse from 4 days after the slippery mucus, because the mucus becomes slippery with the ovulation. So avoid intercourse 4 days from the feeling of that slippery mucus. This is a combination of the two methods. This is something new, standard day method. This is a new thing, and it is a modern family, we also call modern family planning method. It is a new fertility awareness based family planning method. It identifies a fixed fertile window in a woman with a normal fixed menstrual cycle. There is a cyclical beats visual tool, we used to say, and it helps in women to track their cycle, and it is very effective. It is more than 95% effective. You can see this is the bead. It is a recent, not very recent, but compared to all other methods, it is a recent introduction into our contraceptive list. This is the ring, which is mobile rubber ring, which a lady has to shift. So this is a period time, and suppose the next day she has to shift here, then here, then here, and accordingly, then this part, when it comes around white, it becomes risky for. This is the period when she might get pregnant, and then again this is the days when unlikely to get pregnant. So this time she should avoid sexual intercourse, and then she keeps on shifting the ring, and suppose the ring, when she reaches here and she has period, then that means the cycle is less than 26 days. So it is relatively new in India. 2004-05 it is being introduced, and 1800 providers have been trained. It is for these methods, and in India it is approximately 6,000 women are using this. So little more about this SDM method is the fertile window is 5 days prior to ovulation and lasts for 24 hours, means total 6 days. It makes you clear that 6 days you should avoid intercourse, and this method has come out from after analyzing 7,500 women's menstrual cycle by WHO, and they have shown that the cycle of most of the women are between 26 to 32 days, and fertile days are 8 to 19 days of the period. If during that period, if wishes to be sexually active, then use condom. And if more than one cycle, if a woman's cycle is not within this 26 to 32 days, then this method is not good for her. So to use this SDM method, women's cycle should be between 26 to 32 days. So this is included in National Family Planning Norm and policies in 16 countries, because this is a relatively new method and easy for women. And WHO SDM as an evidence-based practice and including it in their family planning. It is WHO's advice, and this has been included in our RCH program and contraceptive update manuals training medical officers in public and private sectors. Little more about contraception in adolescent, young girls. Contraceptive combined oral pills is the most effective method. It increases bone. It is good because it is very effective. Because in this age, it's better if pregnancy happens. Then it is not good for the girl as well as for the baby. So it is because since it is highly effective. So combined oral contraceptive method is the best method for contraception. It increases bone densities, improves acne, and it regularizes menses as well. So these are all needed in such age group. Injectable is not very good. It is every 3 months it has to be given, and it causes loss of bone mass. Barrier method is good because it prevents sexually transmitted disease, but it needs little motivation and counseling. What about contraception in women for more than 35 years of age? COCP is good option, but she should not have any comorbidity. Injectable Depo-Provera is also a good option. Intrauterine devices, barrier methods, all are good for such age group. There is another terminology called emergency contraception. What is it? So this contraception is usually being given to unprotected sexual intercourse. Suppose a couple is not using anything and she has intercourse and they doesn't want pregnancy. So it has to be given like the ways is like one is over the COCP, 2 tablets within 72 hours of exposure, and then 2 tablets after 12 hours. Similarly, POP also. Progesterone only pill comes is levonorgestrel, 2 tablets of 0.75 milligram, and then it should be repeated in 12 hours, 2 tablets. And then it causes, after sometimes few days, it causes bleeding and the pregnancy. Prevent pregnancy, but not a guarantee. Copper T also can be used, but in a patient who is married and who is already kids. Mifepristone, RE486 and Epostaine, they are also a method but not very popular. Lactational amenorrhea method is a method for women who are lactating, breastfeeding their child. So for breastfeeding, if you want to take this as a contraception, then the 3 criteria must be fulfilled. Lactational amenorrhea, the baby should be exclusively breastfeed. Baby should not be given anything else, and it is only effective within 6 months of delivery. And the physiology is increased prolactin level inhibits GnRH, and suckling also prevents implantation. Advantage of this is there's no physical side effect, no financial cost, and increased self-awareness and knowledge, and provided need not to be highly skilled. Disadvantage is, again, it doesn't prevent for any infection, STD, HIV, any sexually transmitted disease. And you have to be, emotional stress is because you have to prevent sexual intercourse, particularly during postpartum, 6 weeks postpartum period. And in here, both partners has to understand. And it is the method not very much effective. The failure rates are very high. A word about male contraception. what are the methods they can use for contraception? So one is withdrawal method. When there has feeling of ejaculation, there has to be out the semen. Condom method can be used by male. It causes contraception as well as it prevents sexually transmitted disease. And the permanent method is vasectomy. It is very good and doesn't cause any problem, because there is a lot of myth that after vasectomy the male will have weakness or anything or a lot of problem, but doesn't causes anything, and it is a good and safe methods compared to female sterilization. So what is the impact of contraception? So the impact is, if you're using good contraception, good awareness, then it stabilizes your population. It decreases maternal death, because still we are having very high maternal death because of high risk pregnancy, unnecessary pregnancy, and pregnancy in very subsequent, in a very close gap. Quality of life is good, because obviously if there's a family limitation, then the finances will be better for kids, for the food, schooling, housing, everything. Opportunity to discuss a problem, because now she has ample time to give her family, for herself, if pregnancy is to be limited. So then the fast fact about contraception is 45% of married women of reproductive age they practice contraception. It's a good thing. Only 45%, mind you, not 70 or 80%. So less than half of the population is only using contraception. The risk with pregnancy and delivery in developing world, in our country is greater than the risk of secondary to contraception. So the problem related to contraception, which is causing danger to a female, is less than the risk with pregnancy and delivery complications. Developing country, they are basically there in them the IUCD, especially Marina, is very popular, and their female sterilization are very popular there. And the developed world, the oral contraceptive, and in developing country, actually the IUCD and female sterilization are very popular. In developed world, oral pills and condoms are quite popular. So thank you very much. This is a very important topic. Everyone, right from student, teacher, doctor, and all the society members which make a part of our society, everyone should know about the contraception and its proper use, which will be good in population stabilization. It will decrease maternal mortality. It will help in the good family well-being as well. So thank you very much.